other underlying health issues. So once those are taken care of in the right environment, if you still have the dementing syndrome, then it's probably something, related to Alzheimer's or other forms of dementia.
Okay. Anyone else?
Regarding the PET scan, at what age would that be advisable? And what is the cost, and what could one do as a result?
Those are all very good questions. The PET scan, we really don't have well-established guidelines at this point in time for those particular questions because our experience with it has been limited exclusively to research purposes rather than to general application. I think at this point in time, the advice that I would give is at the very earliest stages of memory loss, that would be the time to consider getting a PET scan. The PET scan right now will cost between $3,000 and $5,000 depending upon the center you go to, and there is no Medicare payment for that or insurance payment at this point in time. So it's really just unfortunately right now a private pay procedure. We suspect that will change over the next 12 months. And I can't quite remember the third part. Maybe I should get a PET scan.
What do you do with it?
So they're reminding me they don't need the PET scan. So what will you do with it? So if you were cognitively normal and you went in to get a PET scan and you showed a certain value in terms of the amyloid content in your brain, what we will be able to tell you is, as an example, in the next 4 years, you will have an 80% probability of it having some form of memory disturbance. We'll be able to have those numbers. We don't have them yet. And that number I told you is actually if you have a spinal fluid tap and you end up showing abnormal spinal fluid values, those are the numbers that we can give you. So we will be able to give you some kind of percentage, but it's still never going to say you're definitely going to get Alzheimer's disease, and it's not going to say you're never going to get dementia, because you could well get some dementia that doesn't have amyloid involvement if you're negative. But that's where we think it's moving.
I think the goal, as we were talking earlier, is that it'll get to a point where it'll be like, taking an electrocardiogram and going in for a physical at 50 and seeing if it's there, and if it is, take a pill like a statin and dissolve all of that material. So I think that's what the goal is eventually. So, but I think as it grows and gets, they have more experience with it, I think it's an absolute thing for anyone. And I think when you, like my father had Alzheimer's, my mother, my feeling was a little different. She was here and had dementia. I mean, I would be a person that would go in and take this scan. So, people say, why would you want to know? Well, I mean, it's good to know, and maybe you can get into one of their studies and be the guinea pig, which I would do.
Nick, can I just make one comment about that? I think you are the type of person who wants to know, right? But there are probably other people in the room that might be thinking differently. That, okay, even though this is available to me, we don't have a cure yet. I would rather live blissfully not knowing. And neither of those 2 points of view is the correct one. Right? It really kind of depends on personality and what you want to do with your own health.
I have a question. Has there been anybody in your institute thus far that wanted to be tested, not because they have any concerns that they may have a problem leading to this, but because they have the opposite? That because they've lived a very, very healthy, unique lifestyle, which is unique for somebody to do that in our day and age, has this been the case? I know of somebody that did this type of thing with blood work to find out exactly what their blood had been exposed to, and it was very few people that could afford to do this, but they did this to show the likelihood of what's in our blood and what we're exposed to in our environment.
So I'm not quite certain I understand your question, but I'll try and rephrase it and you tell me where I'm wrong. So your question is, I don't think we've had anyone like what you described, but your question is, do I think there will be or should be people who are normal yet very aged who would come in for a PET scan to see if the reason that they're fine is that they don't have amyloid? Was that,
No, my
did
question
you
is
understand it?
that some people would like to prove that even if you are predisposed, in your family or not predisposed, that at any age, from what I understand you're saying, you could be building up this amyloid in your brain. Even though you've taken every precaution to be a healthy person.
Yeah.
So if you ever had anybody come to your institute that wanted to try to prove that point, I think this would be very significant for the population.
Well, we know several things. First of all, we do have a lot of people who are just fine cognitively who come in and it's a part of a volunteer in a research study, and we find that they have amyloid in their brains. In fact, 30% of people over the age of 65, when they are cognitively normal, will show up with a positive PET amyloid signal. Does that answer your question?
Well, some of this has been done by post-mortem studies, autopsy studies. So if you're over 90, the odds that your brain doesn't have any signs of Alzheimer's pathology is actually pretty low. It's pretty scary. But there are many people who are still functioning quite well over 90. And so it speaks to the point about, there are some core things that we know appear to be protective. And it may not be protective from pathology, but it may relate to just overall brain fitness. So you could compensate for the damage if high intellect has been associated with protection from Alzheimer's disease diagnosis. But it's probably not protective from the pathology. It just means you have a lot longer to fall before, or you could compensate for that better before you get diagnosed. Because as anybody knows what the tests are, the screening tests, especially in the primary care setting, they're pretty blunt instruments, and you have to show significant impairment on something like a mini mental status exam to, if you started way up here, you could have fallen a long way but still be just fine on a mini mental status.
Okay?
Yeah.
Anyone else?
Nick, I just wanted to add one thing. Your question is a really good one, and maybe let me rephrase it into another question that we should be thinking about, and that is, the question really is, why do some people with amyloid in their brain develop the disease or the symptoms and others don't? And I think we have a lot to learn from folks who age well, who actually have all of the other factors that may constitute a population of Alzheimer's, but these folks do well. And so we shouldn't just be evaluating and looking closely at folks with the disease, but folks who are resilient from disease, because I think they're going to teach us a lot.
Okay, we have one.
I think that we know that there's a strong genetic component to Alzheimer's disease. That genetic component probably is stronger the earlier you get it. Environmental factors and pinning besides head trauma are essentially unproven. And although, that for many years, we haven't heard a question about aluminum, thankfully. Maybe that's finally fading. But, for 30 years since, since the link between aluminum and Alzheimer's was debunked in the scientific literature, we would get questions about it. And essentially there's no scientific evidence linking aluminum exposure to Alzheimer's disease. And I would say that really for any specific environmental agent besides head trauma, there is no definitive proof one way or another. There certainly can be environmental components, but it's especially, it's very hard to pin an environmental insult, especially if it occurs 20, 30, 40, 50 years before you show the disease, to a given disease. It's very, very challenging. And there was a very interesting study done in Guam where a population got a Parkinson's dementia complex, and they're almost certain that it was an environmental cause because it hit a certain group of people and then it went away, and they were never able to definitively identify what caused it there, even though they went in and really studied it intensively.
Some of the questions I remember my dad was at.
That you gentlemen could tell us about that persons with a real deep interest in all of this could subscribe to and be assured they were getting accurate information instead of all the garbage out there?
A publication, I would say no. I would go to the Alzheimer's Association website, because I think